Happy Thursday. I'm getting the day of the week right. Welcome back. Day 2 of the Psychology and Counseling Summit 2021. Very welcome. Now, before we get started, I would suggest, just like what we did yesterday, is to do a quick grounding. If everyone could just plant your feet on the floor firmly, close your eyes and shoulders back, chest open, put a smile on your face, and go ahead and tune your attention to your breath or your breathing. Just close your eyes, even my speakers as well. That would be great. Yeah. And just listen to the quality of your breathing. Whether it's slow, it's quick, it's fast, it's medium, all good. Smile on your face, eyes are closed, breathing, and just taking note of the quality of your breathing. Breath work just to get us grounded. Thank you for being patient with us today. We were just getting the speaker set up, day 2 of the Psychology and Counseling Summit. Live from Hong Kong, I'm Teresa Siu from Lotus Live TV, your host for both days. Loving it all. Happy Thursday. Happy Thursday. Now, when you're ready, you slowly open your eyes, and I want you to just quickly rub your palms together and then place the infrared over your eyes gently and just feel the warmth. And this is going to help you relax your eyes a little bit because we are on screen quite a bit. All right, that felt good, didn't it? All right, let's go. We're going to talk about, lots of topics around the front and center for all of us over the past year, which is COVID-19. A lot of headlines, cases, lockdowns, and all that, right? So we have a global ground realities as we know, individuals and mental health practitioners as well. Now, the discussion will be followed by a live Q&A session, so do keep your questions coming. So I would like to introduce the panel or panelists, Mr. Patrick Benson, who joins us from Koh Samui, Thailand. Boy, I wish I'm there right now. He is the CEO and at PB Consulting Limited, who is an organizational and clinical psychologist, sharing his time between Canada and Thailand. Now, I have David Chen, who is from the Merlion City of Singapore. He is a professor in psychology and director of the Behavioral Sciences Institute at the Singapore Management University, and Dr. Nakia Hamlet, who is from the East Coast in Connecticut. She is the CEO and founder of Complex Psychology LCC. Now, and finally, my dear friend, all of them are my dear friends, of course, and Dr. Adrian Loh, the best of Hong Kong. He is the president of Hong Kong's Association of Psychology, certified industrial organizational psychologist. And thank you for all of us. And Adrian, the action is all yours. Take it over.
All right. Thanks, Teresa. Hope you guys can hear me clearly. Yes?
Yes.
All right. So I'm going to be the moderator for today's sessions. And I have at least 3 questions for our speaker today. And what I'm going to do is I'm going to use a roundtable approach. And each of you will answer the question about 3 minutes or 4 minutes for each question. And then we'll just do a roundtable thing and let's see how we can come up with some principles or valuable takeaways for our audiences. All right. So the first question is this: as Teresa's mentioned, we have so many things happening right now with the COVID pandemic, and now the vaccines are coming up. So what are the cultural reactions? Or responses and implications on mental health? And probably if you guys can give us some case examples of coping mechanism and how the people from your locality, how are they adapting to it, and what is helping them to support them to deal with these unexpected changes. So I'm going to start off with I would like to invite Patrick Benson. You can start the ball rolling.
Yes, thank you so much. And I'm so sorry again for my camera. I can't find the button for that. Anyway, so in Thailand, when it started with COVID, what happened is on the first sentence, because the COVID didn't come from Thailand, the majority of population assumed that it was a foreigner disease. So if you were Thai, you couldn't possibly be infected. since it comes from foreigners. So they start to take distance with the foreigners. But the Thai population itself didn't really protect themselves in the beginning until some cases came and they realized that, yes, we need to protect themselves. So it took quite a while. And then the military system in Thailand closed down the whole country. And then we managed to keep a very low number because of that. So, and we still close. Here and something later, we still close. There's no need to reopening. And obviously now we are on the vaccination scheme that would start sometime this month in March. So the consequence of that is it has been dramatic for those who were living in areas like where I live, Koh Samui or Phuket or Pattaya or Chiang Mai in the north, where they were expecting to see tourism coming back, the high season between end of December to May. We missed the first season last year, the high season. We missed this season again, and 2 high season missing. Although the average, I mean, the official number in Thailand for tourism is about 12 to 15% of the GDP. In place like Koh Samui, I would say is probably like 75% of what they do in money. And there's nothing else in tourism here, probably higher. So it's a desolation site, like after a nuclear war or something. There's nothing open. There's nothing in the streets. There's a little bit of population, living, and everyone wear the mask. That's the thing. So it was not in the beginning, but now everyone wear the mask, whether it's a high wave or low wave, whether it's in the region or not. It's mask reinforcement everywhere you go, supermarkets or in the street. And the population seems pretty calm when it comes to psychology response. They seems pretty calm. They take things with philosophy. It's the land here in Thailand where they take one day at a time. So it's not a country where they used to plan ahead. Unlike in other continents, like in America, for example, where they like to make plans for the next 65 years, or in Canada, where I'm from, they like to know what's going to happen for the next 6,000 years ahead of them. Here in Thailand, it's only taking one day at a time, and tomorrow is just another day. And we might be here and we might not be here. Part of the Buddhism also, very, very strong. People here go to temple whenever they have no money or whenever they feel there's a need for psychology. So the need for psychologists here is actually the monk. He has been for some time, and the monk offers shelter for. You don't have to pay, but you have to work at the monastery, and you can come and stay for as long as you want. If you want to stay for 5 years, and you stay for 5 years, no problem. They will take you. So the Thai know that instead of the social security network, you will have the monastery that will still take you in anytime for free, for as long as you want. And you will get guidance and food and shelter. So that nice covering in every mind of every Thai doesn't make it necessary for them to go, plus they speak their own language. I mean, I'm a psychologist here, but obviously very few person population speak fluent English enough to have a session with me. So that leaves me to the expats, those we've been living 20 years. But those expats have came here to search for another life away from their original country. And they came here to not ask questions and copy the model of not asking themselves any more questions until they die. So none of them asking themselves questions to the future. They live happy to live day by day. But overall, the population is very calm and live their day as nothing happened. Koh Samui, very lucky. We have no cases since the beginning of the pandemic, probably 6 last year in April and none since then. So it's been almost a year with absolutely no cases here. We wear masks because we have to, but I mean, we don't. If we didn't, then it would be no problem. So that's what I can say so far about my specific area of the world where I live.
Right. So sounds like the workplace has been quite challenging as well in Thailand, where people have to, adapt to the work, to the new standard of a new norm, so to speak. And working from home, everyone is like locked down at home. So I'll come back to you after, Patrick, as
Yes.
in how you can help the clients to recover. And I think you did mention a little bit about mindfulness, right? How the Thai people, living day to day,
Yep.
just by the moment. All right.
Yes.
Now I'm going to move on now to Dr. Neck here. How's the situation in the U.S. from your side?
Yes, so the situation has waxed and waned depending on where you live. I mean, essentially in the beginning, the East Coast and California were hardest hit with the COVID virus. And in those areas, I think at first there was so much uncertainty because it wasn't clear how things would progress. People weren't really clear on what this was and what to expect. I think there was a fair amount of denial in addition to the anxiety and fear. But I think as humans do, we just sort of adapted, as we went, and we're resilient. I think depending on who you were, you handled it differently, with considerations like if you had childcare, or if you had kids who had to be homeschooled at some point, or if you had to go out for work, or if you had a partner that had to go out for work, or another family member. So I think families learned how to sort of communicate and strategize in terms of working from home with children, in terms of safety protocols when people came from the family house, and then figuring out how to see relatives in the community. I think I've seen that as one of the greatest challenges, which I'm sure you guys have as well. People having to accept the social distancing and the isolation, particularly in family structures where a grandparent or another family member outside of the immediate family were a source of support and childcare for kids. And so I think in the beginning, people were really struggling, trying to balance their jobs at home and also helping their children figure out the technology to take part in their classes. And then as things started to open up a bit more, then I think we got into the uncertainty about kids returning to school and whether that would be safe and what that would mean for families. And then as kids started to go back to school, I mean, I think people were hesitant at first, tentative, but the kids seemed to do fairly well. The kids were fairly resilient with the fact that, they all have to wear masks all day. They have plexiglass. In most school situations, they have plexiglass separating their desks from one another. So I think the kids quickly adjusted. And so I think some of the difficulties with that were, if there are cases in the classroom or in a school environment, then very quickly kids had to go back into homeschooling, and parents had to be ready to kind of quickly make that shift. And so I think even up to this point, that's been a real challenge for parents, how to go back and forth between in-class schooling and homeschooling and not knowing when that would happen. But that being said, the schools have done a really excellent job with managing that and really being extra safe and really trying to sort of preemptively have people go back to homeschooling and quarantine just for the sake of safety. And I think for that reason, in large part, we've seen lower transmission rates in the schools. I think the schools now are seen as one of the safer places in terms of transmission of COVID. And so again, in the beginning, we weren't so sure if kids would transmit the virus, if the kids could be as affected by the virus as adults. But we have since learned, I think, that kids, while they may be carriers, they tend to be less impacted. And so the schools, I think, have mostly figured out how to manage that. Some families are still struggling a bit, I think, with the homeschooling when that comes up. Also for kids with special needs or kids who had developmental disabilities or other challenges, the homeschooling has been very difficult. So I'm sure now that kids are back at school, teachers are going to have to spend some time on remediating, delays or deficits or lack of progress that kids have made. So I think the next year or so in school will really be somewhat of a catch-up year, because parents and teachers are going to have to sort of review some things or help the kids kind of make progress. On the other side of it, I would say that as we've gone, I think people have developed strategies to manage the other aspects of this. I mean, I wouldn't say that mindfulness is necessarily a way of life for everyone, but I think inadvertently people have had to adapt that sort of mindful stance where, there's so much uncertainty, lack of control. We don't really know what's going to happen. I think in that process, people have learned to be a bit more present in the moment. And also because our schedules have slowed down with working from home, I think people have started to have time for activities and explore things that maybe they hadn't before, either projects at home or artistic interests, or even just spending more time with families and friends, even if it was virtual. And so I think what's come out of it is people kind of rethinking the work day, and rethinking how they spend their quality time, and I think really appreciating time with their families. I mean, of course, there's been economic aspects of this that are continue to be challenging, and I think for years to come are going to be a struggle, in terms of income lost, or businesses that aren't going to be able to reopen after COVID, and people having to really think about their financial standing and their jobs and reorganizing things. So I think that's going to be a continued challenge as we go through this process. But I would say one really main thing is the resilience and adaptability of people as they've kind of just managed it day to day. And I feel like now that we're moving into spring, I think people feel hopeful. The vaccine is being distributed, as quickly as possible, and there's some thought that everyone will be able to be vaccinated by May, and so I think people feel relief, and I think they can kind of see the light at the end of the tunnel at this point.
Yeah, yeah. Thanks for your wonderful insight. I think one takeaway that I get from your sharing is that it's helpful if we can agree on some household rules, with our family members. Like, for example, communicating who will be leaving the house, or what sort of procedures we can have to manage the risks if someone's return from house. And as you mentioned, there's lots of anxiety right at home. Yeah, I think this would be helpful as we communicate these issues. All right. We'll come back to you again, Nakia. So how about David? How's the Lion City going?
Lion City, yeah. Well, thanks for having me here. I thought it's good for you, Adrian, to start with a cultural question. I think there are cultural differences, of course, among the cities and countries, but underlying it, I guess there are some cultural universals of the human condition, of the global pandemic as we face it together, right? So, like everybody else, I think Singapore on January 23rd last year, that was when we had our first imported case, right? Someone in a family flew in from Guangdong, right? He's a Wuhan national from China. And then we heard about the case and so on. And there were a few community spread here and there, a few cases, but not many. And the government then set up a task force about the same, just about the same day. And most of you who know about our Singapore government is pretty structured, pretty efficient public service. And actually that helps a lot, I must say, because leadership was critical, able to make pretty difficult decisions, able to communicate clearly to the community when there were uncertainties and so on. So I think that played a major part. In the beginning, I guess, like many other individuals across regions and conditions, in the beginning, people never knew that it's going to be so serious, right? So everyone, including leaders, were like, okay, we do what we can, set up temperature screening at borders and so on. And then you try to have some rules here and there, tell people to be careful, but not too long, about January, February, maybe March, the cases became pretty clear globally. And so our situation was that I think our experience with SARS many years ago did help. Most of you will be familiar with the SARS, which was also a pretty bad disease. The fatality rate was actually much higher, than the COVID-19. But it's not as virulent. So the situation did not last very long. But because of SARS, I think many years ago, in addition to the usual quality health care investment that the country made, the country began, I think, to realize the importance of crisis management. So not only committees, but structures were set up, processes were set up. And I thought the civil service, the public service, the people, the NGOs, and the leadership was one advantage was that we were all pretty future oriented. So there's a tendency to say, yeah, of course, we need to deal with the now and current, but with each action, we try our very best to anticipate, say, look, what are the consequences? This positive multiplier could happen, but so can that negative unintended consequences and so on. So that future thinking, I thought, was quite helpful. So in the beginning, there were quite a big of a problem with having to address issues with our migrant workers. So we have quite a large population proportionally to the population living in Singapore who are migrant workers, and they live in dormitories. And because they live in dormitories, even though if your conditions were okay, you have quite many people living together within the same room with interactions. Then, of course, now we know how the virus spread, and with that kind of conditions, the virus spread pretty quickly within the dormitories. So the dormitories were a problem in the first few months last year. And a lot of effort were taken to try to contain that. Right? So that I thought was the main thing that happened. In fact, 90% of the cases in Singapore were happening in the dormitories. Within the community, there were very little spread. In fact, for the past few months, according to our records, we have daily reports of how many people get infected and so on. For the past few months, it has been 0 or sporadically 1 or 2. And then we have about 20 or 30, in a population of 5.6 million who are imported cases. So these are not people who are living in Singapore. These are people who came in cross borders because our borders are not entirely closed. We allow travel bubbles. We are based on humane reasons. We allow people to visit, say, a sick relative who are living in Singapore and so on. But we test them the moment they come into our borders. And then when you are tested positive, we actually have a SHN, right? We have a stay-home notice. You have to, by law, go to a hotel or go to a facilities which are pretty decent, and you actually live there for 2 weeks, so that you get tested again. And if you're okay, then you are free to move around and so on. And then if you're not okay, then of course we send you to the hospital. So I think those leadership, public service, NGOs, the community coming together make a world of difference. But maybe I should just be brief and end off though by saying that the crisis is pretty protracted, right? Actually, even with vaccine, it's not going to solve the entire problem. It's just one critical component, but not a panacea and not a silver bullet. And I think that is a challenge for all countries, I would say, including Singapore, to remind our population that you still have to maintain quite a bit. Everybody is quite happy about it. In fact, those has been internalized. So if I walk in the middle of the night, there is no one that's going to catch me because it's in the middle of the night. But everybody is still wearing the mask, right? So people are not wearing it because you will get fined, but people are wearing it because you feel that you ought to and you want to and you should. I think those norms are very important. But just one quick thing is that even though Singapore is pretty small, 5.6 million by all standards compared to some big cities, that's about the population. One thing that came out in terms of mental health that was very clear was the segmented approach when you look at the population. In terms of disparity between people who are lower, middle, or higher income, your impact is affected very differently. Obviously economically, but because it's multifaceted, then it spill over to your social, your psychological, and therefore your mental health and so on. I think that is something I hope we can spend more time to talk about, learn from each other. And I'm sure, Adrian, your subsequent questions will probably cue us towards some of these things. One thing that I've been trying to share, in all my talks and writings is that, especially in Singapore, actually the people who are of the lower SES, right at the bottom deciles, things in Singapore are actually not bad at all because the problems are so salient. The government will have budgets to take care of them to make sure nobody falls through the cracks, right? So because they are a salient problem, you actually invest a lot of resources on them. But sometimes there's a group that we need to pay more attention, and that is actually the big masses of the middle class. Because what the lockdowns have done and what the global cross-border closure has done is that people lose their jobs. And when you lose your jobs, every other things happen. And these are the people who were never on welfare, who were never dependent on government or the state. And suddenly you have a dignity issue because suddenly you are without an income and you have to deal with all kinds of things that you're not used to. I think for the mental health community, there is an angle that we need to pay a bit more attention because you are dealing with clients that actually do not have a history of things, terrible events going on in their lives where help seeking is quite normal, dependence is okay, and this how to deal with it. So our assumptions in the mental health community probably need to take a relook. Perhaps we need a segmented approach, just like leadership, dealing with different classes of clients with different backgrounds. It is quite good to have the humility to question our assumptions within our practice and so on. And of course, research, if we have time, we can talk a little bit about that. Thanks, Adrian.
Thank you so much for your wonderful insight, David. A couple of points which I have been taking notes as well, and I just want to share with you guys is what David mentioned is the leadership involvement. That's so important, right? How the leaderships communicate reality and the philosophy behind it. I think that is an inevitable agent of change. And also, you mentioned something about learning from past experiences like the SARS, right? And I think what we as the one Nak here has talked about the resilient, right? How we build resilience is also about how we can leverage on past successes. I think that is very important factor to build up our resilience so that we can continue to advance and to thrive despite the adversity. All right. Now, as we all understand that the four of us, we are all psychologists, right? And we are always helping people. We're always helping people to recover. And I'm sure the audiences here are mostly from the helping professionals as well. So I'm going to come back to Patrick Benson. Can you
Mhm.
tell us, give us some insight, how you help your clients to recover, or how you help them to build resilience, and maybe how do you leverage the trauma and the pandemic now, the adversity? How do you leverage this to cultivate the growth? And you can also talk about that's the new norm of how we use the technology, and what are tips for the audience when they are working from home.
Mhm.
Back to you, Patrick.
Right. So, in my small little practice here, clinical psychology, that I've set up here in island of Koh Samui, have mainly expat population. As I say, the Thai population rather go to see the monk, which is fine enough. So, among the clients I've got here, um, there's two sort of problem. There's those who still have a job and trying to adapt to the new normal, and those who doesn't have a job anymore. And so for those who don't have a job anymore, obviously is the immediate stress or where can I find a job immediately? And that's create anxiety. They lose their sleep. They start to worry much more than necessary. And when you're worried, as you all know, you don't think straight anymore. And the more you worry, the more you're losing a clear view of what you should do. So it inhibits your cognitive ability to think straight. What I do, there's a lot of breathing techniques and things I do. I use CBT most of the time, but trying to recenter them into the moment. I use like a center therapy also where people have to recenter themselves to what is happening here and now today, and what they can do for the time being, and not trying to predict the future of unknown future that no one knows. Once they manage to calm down a little bit, they can look around and see what kind of structure and what kind of other help. Most of the time, when you're in panic mode, you don't see what else you can do or what else you have within your skill sets. And yes, in time like today, you have to be pretty flexible in terms of what you can do. It's not necessary. Like I came, for example, I came to be a clinical psychologist, which is where I am. But I also opened a restaurant with my wife because that was the only way to complete moving. So, and I never cooked. I mean, she's cooking, not me. But it was not something I intended to do when I came here in Koh Samui. I think there was enough restaurants, but we opened one. And there was like a way to think outside the box. What else can we do here? Because for the time being, we're here and we have to make the best of it. So when I give an example to my clients and I ask them, like, what else can you do? And with the use of technology, you're not limited to one island or one country. I mean, it's possible to find a job somewhere else. And many people didn't think that it would be possible with a small setting. So, or they wouldn't think that another country, why should hire me? Yes, maybe in the old days you were right. You would probably required to be on the spot. But nowadays, I think the workforce is going to be spread out in many places, many timeline, and I think there's a new normal for also the working environment. So I've seen a lot of anxiety. I've seen a lot of people using alcohol and drugs. There's an increase of alcohol and drugs. I used to say, psychologists, we're always the last in line. First, they go to the bar, and then After they go in the bar, many times they go to the doctor, GP. After 6 or 7 times, the GP see the same person, finally make a recommendation to see a psychologist. By the time it's been 3 or 4 years, the liver is gone and the economy also is gone. And then when it comes to you, then you're trying to pick up the rest or what's left off. It's certainly true. It's true in North America. I mean, at least from what I know from Vancouver and the west part of Canada. It's also true here, where people always go to the hairdresser or to the bar first to tell them life. You know, when I stop to a bar, when I go to cut my hair, I say, you know more about people than I do, because they come freely to talk to you. So that's true. The need for talking is absolutely there, because human are human. They need to share their experience, share their burden, but it's not necessarily they're not necessarily going to the right people that have the tools to help them. When it comes to here in the South, there's a lot less companies established. Everything is in Bangkok, in Thailand. It's almost 2 countries. You have the modern country Bangkok, and you have the rest of the country that we call Thailand. And so most of the big organizations, I would say 95% of them are based in Bangkok. So those are the ones that will be permitted to work from home. Here, they use computer in the hotels, but they're still living at the hotel, so they're not really going anywhere else. So something that allowed me is before COVID, because of the trend and because of the economic growth, there was like among the young population here, there was like a spike, a rise in suicide among the young population, the local population, because as the price of the land and price of things was further going away from their mean, they didn't see any future for themselves. If there's no education, they couldn't see how they can make it. So there was already a very high tendency of suicide. COVID accelerated that even more, because they even less so see a future in front of them. So the suicide, unfortunately, have increased about 30% since COVID, and it was pretty high before. On island like Koh Samui, with only about 70,000 people lived, about 1/3 are expat and 2/3 are local Thai people. And we're talking about a Thai population here. So we're talking about 40,000 people, and the young, maybe 15,000 young people. When you have 30% of them committing suicide, you wouldn't have any generation if you carry on like this too far. Within 10 years, you have no young generation. So unfortunately, and I took a picture I wish to share. There is only, I went through the islands because knowing I'm going to talk about it, trying to find what they do. Okay, I do it for the expat because I don't speak Thai. What do they have anything to help the young people? And I find one, and he says clinical psychology thing. So I thought, oh my God, there's one. He was saying in Thai, and I pushed the door, and instead of being a clinic, I don't know, the sign was there, but behind the door, it was a broom room where they put all the buckets and the broom to clean the floor. There's actually nothing there. So I took a picture of that, and that sadly, this is really the offer. None.
So, right now, with the pandemics happening, research has shown, that working from home has actually increased burnout. Yeah.
Yes.
So in fact, there's a really alarming level of burnout and concern for this exhausted workforce, isn't it, in Thailand as well? So
Yes.
I think what you mentioned over here is really critical, as in we really need to allow time for ourselves to have an outlet, to relieve our stress. And perhaps, we really have to, find activities that we can really enjoy despite the limitations that we are experiencing. Right. So over to you, Nak here. What are your thoughts about the second question which I posed in the US context? How would you help your clients?
Yeah, so I'm in an actually interesting position because I have a assessment and consultation business, and so my contact with clients is a bit different. I do forensic evaluations, and so I see clients mostly through assessment. But the interesting thing is I had started sort of shifting my focus to focus a bit on therapist burnout and burnout among mental health professionals. Having experienced my own burnout from doing, almost a decade of clinical work with clients who had complex trauma and in a very high stress clinic setting. And so that was already sort of my focus before COVID. And so also part of my work is I supervise psychology fellows during their pre-doctoral internship year. And so I also have some contact with clients through helping them with their work. And so I can see, particularly in the context of doing mostly therapy on these virtual platforms, it's been very stressful. And I can speak probably more to the clinical side of this in terms of the therapist. I've seen them really trying to engage their clients, and this would be with dialectical behavior therapy, cognitive behavioral therapy, some psychodynamic therapy, but mostly the behavioral therapies. And I think it's been challenging, especially because if you think about that year of training when you're an intern and you're very focused on, learning as much as you can and having as many experiences, this is obviously completely different in the context of COVID. And so trying to engage patients for the first time in a virtual space who you don't have a prior relationship with has been very challenging. I think particularly with children, because when you're thinking about child therapy and play therapy and how you interact with kids to help them, it's really hard to do that in a virtual space. So I think clinicians have been really challenged to think about how do you engage children in this space and how do you support their parents with things that you may want them to do to help support the kids. The other interesting thing is that the populations that I've primarily worked with and also the fellows that I currently supervise in their work are families and children who were already highly impacted by poverty and socioeconomic disparities and complex trauma and some serious psychiatric issues prior to COVID. So it's been also interesting to see sort of families that were already really struggling, and then you add COVID to the mix. And so it only impacted situations that were already really stressful. And so I think in large part, many of the clinicians that I've been working with are really just trying to support the families as best they can. So there's a fair amount of case management, trying to help the families have resources, helping the families think creatively. If one family member, just has to go to work no matter what, or if they have to live in close quarters because that's just where they live and that's the resource that they have, how do you help support a family when they're kind of not in the best circumstances? And then, to Dr. Benson's point, depression, suicidality, those things are exacerbated and have been. And so managing that risk in a virtual space presents another challenge that I think clinicians have had to work through. On the clinician side, though, as I said, much of my focus is helping clinicians figure out how to, practice radical self-care and how to really try to manage this, because I think this is one of the first times that we've actually been doing therapy while probably actively experiencing trauma ourselves. And so how do you manage helping someone when you're actually going through the same thing and you have the same questions and the same uncertainty and the same fears, or even I know clinicians who've had COVID or who had family members that had COVID or unfortunately passed away due to COVID. And so, I think it's been important as therapists how we start a conversation about how do we heal ourselves from this experience as we continue to support other people. And so I've started having that conversation more with the clinicians that I'm in touch with, and I think that'll be an ongoing conversation through the next couple of years. Frankly,
at least, yeah.
Yeah, and I think we had a little bit of conversations prior to this meeting, and I understand from your work that we really have to look at certain behaviors, not just other people, even ourselves, right? Because depression is a really complex and insidious disease that can wax and wane, the course of someone's life, right? So I think for everyone, including myself and the audience, maybe some symptoms we can look out for are maybe the sense of feeling tiredness or no longer enjoying activities that we used to enjoy, or feeling helplessness or even suicidal thoughts, and we really have to be these cannot go unnoticed, especially for us as helping professionals. All right, just to be having an interest of time, over to you, David. What about in Lion City? How do you help your clients to overcome this situations?
Well, I can share about the Singapore situation in general, and hopefully some of these learning points we can have mutual discussion and learning. I like what Adrian. I like what you said about looking out for signs, and what Nikhil said about we as meaning the whole mental health or helping profession as people who are happy. In this case, professionals. You yourself are undergoing the same situation. In many sense, as you are helping, you do need help yourselves too. And so that prompted Adrian's point about prevention. And in my view, I'm a researcher, but I'm also a scientist practitioner in terms of the way I approach things. I think it's quite important to look at individual mental health in terms of dealing with it, recovery, resilience, and all. In the same way that in the macroly, how you will look at it as a crisis process, and therefore understand the whole process in terms of prevention and then response as well as recovery is really, really critical. And I think Patrick made a good point that by the time you come to the psychologist or the professional helper, it is a kind of a little bit late because, actually it need not be years, it could be just months. And by that time, because you don't intervene early, the problem is much, much more difficult to deal with, right? Both psychological, socially, and also economically, right? You think about it in terms of the kind of investment, you have to pay salaries of people, you have to have tertiary help, hospital settings, and so on. So I thought that's a good point for the mental health, the helping professions to think through that, it is really about prevention, response, and recovery, and not, we don't come in at a time when there's a problem that is already pretty serious. You need to look at it from the entire process. And related to that, I thought in the case of Singapore, of course, when COVID happened quite early, we begin to realize that mental health is going to be a big issue. And I would say that, of course, what we were concerned was things like depression, suicide, and all. Especially, we were very concerned with the migrant workers who were still living in a kind of a crowded conditions, and they are not allowed to get out. Then when we have lockdowns, or we call it circuit breaker, you have to stay at home for a month or so. And even if you have Netflix, I can tell you, it can be really terrible having to break your routine and not have interactions. And Zoom and virtual meetings help to some great extent. But bear in mind, again, many as human beings, we need a lot of social interactions. Smiling to you and having a physical pet on you, is really quite different. Similarly, there are also people, again, from disadvantaged groups. They may have a computer, but the laptop or the computer is actually shared by the entire family. So when you have a family and you're working from home, the father or the mother holds on to the computer. Now, if you are trying to study from home, but you only have one laptop, so issues like this, sometimes we are not too cognizant of, to realize the very disparate or recognizing the problem and then having various kinds of approaches to deal with it, be it cognitive behavioral therapy or some other approaches. But I thought what I'd like to highlight is that very often, I don't know the extent, but some helping professionals or mental health professionals still tend to take a very individualized approach rather than a more systems perspective. The other ability to understand that the individual's behavior is a function of the background of his or her experiences in the past 1 year, as well as the context that he or she finds herself in. The example I gave about the family sharing one laptop. Therefore, that family situation, of course, affected that particular individual. So I guess the ability to go beyond our usual training about, recognize the problem, how to deal with it, help people to face it and be sustainable and have resilience and all. We need to be a little bit careful because sometimes when we go on and on with our background training of one way to approach the issues, it backfires because the client will look into your eyes and what is in his or her mind thinking is probably like, you have no clue what I'm going through. Where is the empathy? Are you taking the perspective that I am having? And particularly important in Asia or maybe East Asia is that seeking mental health help is quite taboo. Unlike say in certain Western countries, going to a psychologist is not end of the world, right? But in certain cultures, going to seek help for mental health is quite a challenge because You don't want people to think that you're not okay mentally. That kind of obstacles have to be a bit, again, we need to be a bit cognizant of. Another point is that most mental health problems, when you come to the front desk or the frontline helpers or the professionals, is never presented as a mental health problems. Right? In other words, it's presented as, oh, I'm in debt. Oh, I quarrel with I have a family dispute. I have a domestic violence. So when it was first presented, when the issue is first presented, often it's not clear that it's mental health, but there are many mental health issues that's underlying it. So I think that is another thing about training our mental health professionals to be cognizant of and so on. I won't go on and on because there are so many things that we can talk, and I think there's a Q&A situation. But I do want to end off with saying that I think whatever we do for resilience and recovery, it needs to be sustained and sustainable. It is just not possible proportionately for the mental health professional to solve mental health problems. And Adrian's point about prevention, I really like it because I think we need to make the distinction between the mental health and mental well-being as a broader concept and mental illness. So mental illness is not just the opposite of good mental health, and mental well-being. Actually, it's a big circle, and some people will never go into depression, but they will still have a problem in terms of quality of life and so on. So once we recognize that, then we are able to address the huge masses population's quality of life, as well as preventing them from going through the pathway and entering into a more severe mental illness. I should stop.
Yes. Yeah. What you made is a really great point. There's no one size approach. Yeah. Even I myself, when I approach my clients, I would approach them not just from one single point of intervention. We have to look at it from the psychological, the biological, social, and even the spiritual aspects. Teresa is back. For the interest of time, I'll just pass the time back to our lovely host.
Thank you, Adrian and David and Nakia and Patrick for wonderful sharing. And I think one of the most important points is that we all have to start out with self-care with ourselves as practitioners. So sorry, we're not going to have time for the Q&A session, but if you have questions, go ahead and save them and we could, deal with those a bit later. Thank you so very much. We'll take a quick break, transition, and we'll come right into the next session. Thank you very much and good night, Nakia in Connecticut. And good day, everyone.
Thanks, everyone.
Yes. Thank you for having me.
Thank you for having me. Yes.
Thank you.